Good afternoon. Today is Tuesday, February 2nd. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me once again today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. As of today, our County Health Department has administered 1,997 first dose vaccines to people in the Phase 1A and 1B priority groups. Starting tomorrow, the Health Department will begin holding second dose clinics for first responders. Others in the New York State priority groups, including frontline healthcare workers and senior citizens, are receiving vaccines through Oswego Health, area pharmacies, and other healthcare clinics. Requests for vaccines continued to far outnumber the vaccine supply in New York State. The County Health Department is administering vaccines to eligible groups in the most efficient way possible. The supply of vaccine that we receive remains inconsistent, and it is challenging for the Health Department to schedule clinics very far in advance. Here in Oswego County, we still haven't received enough vaccine to take care of all the first responders in the first priority groups. New York State has assigned hospitals to vaccinate the Phase 1A population of doctors, nurses, and medical workers. Our local health department is assigned to vaccinate essential workers identified as part of Phase 1B, first responders, educators, frontline workers facing the public such as cashiers, and others. Local pharmacies are charged with vaccinating those aged 65 and older. In Oswego County, these pharmacies include Kinney's in Oswego, Mexico, Fulton and Pulaski, and Wayne Pharmacy in Oswego. Appointments must be made online through the Kinney Pharmacy and Wayne Pharmacy websites. Clinics are usually not scheduled until the provider knows how much vaccine they are receiving from the state, so people need to keep checking the websites frequently. Those aged 65 and over who need assistance may call the County Office of the Aging at 315-349-3484 for help navigating the internet and making appointments. People have asked if the County Health Department can visit homebound seniors and vaccinate them so they don't have to travel outside their homes. The current state guidance doesn't include this population. The New York State Department of Health is starting discussions around planning on how to vaccinate the eligible homebound population. We will follow the state guidance. We also realize that many of you are anxious to receive the vaccine, and we appreciate your patience as we work through this process together. Next Tuesday, February 9th, the Health Department and Pulaski Urgent Care will hold rapid COVID testing at the Paul V. Moore High School parking lot in Central Square. Pulaski Urgent Care is partnering with the Health Department to bring its mobile unit to a different location every week. 100 appointments will be available to Oswego County residents and those who work in Oswego County. The testing is free, and the appointments must be made ahead of time. To make an appointment, look for the link on the Health Department's COVID-19 page or call the COVID hotline at 315-349-3330. Although case reports have started to decline, I'm sorry to say that we have now lost 85 members of our Oswego County community to COVID-19. On behalf of the county legislature, I once again extend our sympathy to their families and loved ones. We must continue to be proactive about our preventative measures to protect ourselves and our loved ones.
Thank you, Chairman Weatherup. After 2 months surge in COVID-19 infections, Oswego County has seen a sharp decline in the number of new cases in the past 10 days. The county's 7-day accumulated case count decreased 50% from its highest of 643 on January 16th to 321 yesterday. This trend is consistent with declines in new cases across the state and nation. This morning, the 7-day positivity rate was down to 4.3%. That's a significant improvement from where we were just 3 weeks ago at 9.4%. But the drop in cases, however welcome, does not bring relief from the virus. The emerging coronavirus variants, the slow vaccine rollout, and the continued caution fatigue mean the pandemic will be with us for several more months. Facing the challenge of inconsistent vaccine supply and the threat of coronavirus variants, the county will continue to increase testing, trace close contacts, and vaccinate when vaccine becomes available. As of this afternoon, we have received 134,220 tests. We've had 5,800 positive test results. We have 420 active positive cases. We have released from isolation 5,295 residents. We have 85 deaths due to COVID-19. We've received 126,444 negative test results. We currently have 975 residents in mandatory quarantine or isolation. And the County Health Department has vaccinated 1,997 individuals to date. Starting this week, New York State is allowing youth to participate in higher risk sports such as ice hockey, basketball, volleyball, competitive cheerleading, provided certain requirements are met. The County Health Department developed a policy for higher risk sports, and we announced the new guidance last week. The state's decision to permit higher risk sports and recreation activities does not mean that the COVID-19 risk has changed. Anytime there is a gathering of people, there is a risk of exposure to the coronavirus. The virus may be spread in locker rooms, school buses, and other areas in addition to sports event venues. The Health Department policy allows student athletes to take part in higher risk sports in recreational leagues or schools following these guidelines. School districts and youth sports leagues must follow the New York State interim guidance for sports and recreation during the COVID-19 public health emergency, which is posted on the County Health Department and New York State website. Sports activities will be placed on pause if the 7-day rolling average of test positivity is more than 8% in the Central New York region. The County Health Department reserves the right to pause all higher risk sports if Oswego County experiences a spike in infection rates. School districts and recreational leagues must submit plans to the County Health Department at healthdepartment@oswegocounty.com. Spectators, including family members, fans, and volunteers not required for the event operation, are prohibited from attending events at this time. However, this decision may change in the future. Carpooling and overnight travel are discouraged. New York State social distancing and other guidelines should be followed. Each school's medical director must approve the district or school's participation in higher risk sports. The Health Department recommends that the School Board of Education or Board of Directors also approve the district or league's participation in each specific sport. Travel to and from interstate competitions is prohibited. There is a significant risk of transmission to people who live in the same household as an infected person. Ultimately, the decision falls on a parent or guardian to decide whether they will allow their child to participate in each sport or activity. The Health Department's COVID-19 hotline is open Monday through Friday from 8:30 a.m. to 4 p.m. and Saturdays and Sundays from 9 a.m. to 1 p.m. The number to call is 315-349-3330. Thank you.
Thank you, Diane. I want to remind residents that the county can now provide free transportation to people who need rides to COVID-19 testing and vaccination appointments. The program is a result of the partnership between county government and Oswego County Opportunities Incorporated. We don't want the lack of transportation to be a barrier for those who need to be tested or who are eligible to receive the vaccine. Transportation is available Monday through Friday between 6 a.m. and 7 p.m. Appointments for rides should be made in advance by calling 315-598-1514. Thank you for your patience and for doing your part to prevent the spread of COVID-19. Stay safe on the roads. Continue to maintain safe behaviors, including hand washing, face masking, and social distancing.